And now, Doc Talk, brought to you by Plateau Medical Center. Here's Dr. Paul Conley.
Hello, I'm Dr. Paul Conley, and thank you for tuning in to another episode of Doc Talk. This evening, we're actually live here at Plateau Medical Center. We're on site in one of the operating rooms. Today, we have actually Dr. Yancy Short. Dr. Short is actually our Chief of Surgery, and he's actually the head of our robotics committee. So this evening we're going to talk about robotics. We're going to talk a little bit about the renovation of the new ORs that we have, but we're also going to talk about how robotics have actually changed how we proceed with different surgical interventions, and we're going to talk a little bit about who should receive a robotic surgery, and we're also going to talk about the advantages of robotics as far as recovery time and outcomes. So Dr. Short, thanks for coming on the show tonight.
Well, thanks for having me, Paul. Appreciate that very much.
Well, I really appreciate, first of all, you inviting us here at Doc Talk to come inside of one of the operating rooms. This is a real treat that we actually get to come on site, and we're actually sitting inside of one of the operating rooms here at Plateau Medical Center. And obviously here in the background, we actually have the robot that you use here, and we're going to talk a little bit about robotics. So I guess the first question I want to ask you, Dr. Short, is how did you decide, or how did you get started in the field of robotics?
Okay. Well, when I came out of residency, of course, there was no instrument called a robot or any robots that were being used. And I was in practice for a number of years. And in 2016, I was offered a job in Huntington to come to St. Mary's to join a friend of mine and practice. And I came from Summersville, and they did not have a robot. I just kind of heard of it. At that time, I was a little bit skeptical about the robot and what it would be and how it would help surgery. So when I went to St. Mary's, I started doing my laparoscopic surgery and doing my regular surgeries, and the robot representative came to me and said, hey, would you be interested in going to a course and learning how to use a robot? So I said, sure. So in 2016, I was sent down to Atlanta, Georgia, and spent days learning to use a robot.
So I know you're head of our robotics committee, and with that committee, can you describe a little bit about who can use the robot? Is it something that just anybody can use a robot, or is it something that you have to have some special training and some skill set when we talk about robotics?
Well, newer surgeons that are just coming out of training, a lot of them are actually trained in the residency program. So when they come here, they've already been trained. They already have enough experience and enough cases to get privileges to use a robot. If you've never been on a robot before, you cannot just start operating on the robot. You have to go to special training. You have to be signed off by a company that offers robotic training. And then when you come here, you usually have a preceptor who watches you do a few surgery to make sure you're proficient in the robot before you can get full privileges.
So basically, if you were to have a patient come and see you for a robotic procedure, not only have you went through number of cases, but you actually have that skill set. And so I think that's something that's here in West Virginia, to be able to offer robotics right here at Plateau Medical Center. I think it's something that I think about just in my training, how this has really revolutionized people's outcomes and the benefits. So in saying that, when we talk about robotic surgery, as a general surgeon, tell me some of the types of procedures or types of things that the robot can be used for. I mean, obviously, I'm an endoscopist, and I'll find a bowel case or a colon cancer or a stricture that I'll send to you, and you'll do robotics. But I know there's other things that also you can use the robot on.
Okay. Basically, the robotic platform is just very advanced laparoscopic surgery. When you're doing laparoscopic surgery, you're standing at the table and using really long instruments through some small metal tubes to do the surgery. In robotic surgery, you basically put the instruments through a tube and attach it to robotic arms, but I control it completely from a console that allows me to see inside the patient and control all the instruments in the abdomen with precise movements. So once you get to understand what it is, some people are a little scared of it, but it goes well. As far as what I can do anything with a robot that you can do with a laparoscopic surgery. I can do gallbladders, I can do hiatal hernias, I can do abdominal wall hernias, groin hernias, I can also do any type of mass in the abdomen to remove. And the biggest thing I can also do is colon cancer surgery or diverticular surgery. So pretty much anything in the abdomen can be used with the robot.
And when we talk about robotics, I think it's one of the things I know you really help, push us ahead here at Plateau, because tell me if I'm wrong, but the robot that we're looking at here, this is kind of like the new generation robot, correct?
Yes. Yeah.
So tell me what makes this robot better than maybe the older generation or some of the older robots, and how does that help?
Well, I trained on this one. I say this is kind of like the Cadillac of robots. The first robot that Plateau had was like the first generation robot. Not really clunky, but it was a little stiff. It was made to work in one area. You couldn't really go in and work very much around. You had to stay in that area. With the newer model, you basically can turn and work anywhere in the abdomen you want. So it gives you a lot more ability to access the abdomen and to do surgery from just 3 or 4 minimal holes. The visualization is a lot better. The high definition camera and lighting is more superior. It also will set the robot up to keep it in the best ergonomic position so the robot works better based on its positioning. You can also sync it with the table, so you can actually move the table and the robot will move with the table, where the old one, if you moved the table, you had to disconnect everything, move the table, and then hook everything back up. So it's basically streamlined and made surgery a lot better for the patient and for the surgeon.
So tell me a little bit about, when I think about whenever I was in medical school, and again, that wasn't all that long ago. We're talking like, in the early 90s. I remember doing some of these cases where, again, the bigger the surgeon's hands, the bigger the scar, the bigger the incision to get the hands into the abdomen. So I guess one of the things when we think about an open procedure versus laparoscopic, what you spoke of, and when we talk about robotics, if I were to come to you and I say, I want to know what is the benefit of this robot here versus the old days where you took a scalpel and you gave me an incision, what would you say to me as far as like why I would want to do robotics and what's the benefits of that?
Okay. I mean, each procedure has its own little nuances on what's best for that procedure. But overall, basically, when you're using smaller incisions, there's less trauma to the patient's abdominal wall, which is usually where I'm using it. So postoperatively, they have less pain. They use less pain medications. And because you're not making a big incision, they're usually back to full activities as far as eating, lifestyle, and work quicker than they would have been with the old-fashioned incision. So that's the biggest thing that I see is just it has a lot less impact on a person's life when you do it with minimally invasive surgery.
We were talking a little bit earlier, as we were coming in the room setting things up, and I was talking about, I remember making rounds in the older type of surgery, the open surgery, these bowel cases, the patients would have this tube down your nose, this nasogastric tube, catheters in place, tubes and hoses. And now, these people that have this robotic procedure, the exact same operation, they're going home within a matter of a couple of days, sometimes the next day. And it's just been amazing to me, the recovery. And have you seen that as well with the robot?
Oh yeah, I think the biggest one I see is like you were talking about colon surgery, whether it's for cancer or for diverticular surgery. Used to cut somebody pretty much from the rib cage to the pelvis. They'd come in the night before, you would cut on them. They would require large amounts of pain medication. There's you're touching a lot of things in there, and so everything's stunned for a few days. So it would take a week to 10 days for a person's bowel function to come back to be able to eat and go home. Now I do their surgeries. They wake up. I don't have a tube down their nose. Here lately, I've not even been leaving a catheter in their bladder, which like a lot of people don't like the Foley catheter. And that evening, I'm giving them liquids. And I've had patients not even require narcotics to control the pain. And I've had about 3 or 4 colon surgery patients actually the next day, they're eating, they're walking, they're using the restroom, and they're not even taking pain meds. And they're like, "Doc, can I go home?" First time somebody asked me that, I was a little leery because I was used to 7 days. So now I've had a few patients that go home same day. and my average is probably 2 to 3 days that people are actually already back home after colon surgery. And that was absolutely unheard of even 5 years ago.
Well, I mean, we were even talking a little bit, you were talking about a patient who had, you're talking about other things other than bowel cases, but like hernia. I mean, you're telling me that you had a patient who had a robotic hernia, and you were telling me like within a day or two they were mowing the grass.
Yeah, I had a guy that had an inguinal hernia or a groin hernia. I fixed his hernia on a Monday. Wednesday he mowed the grass and he took out his Harley on Friday. I also had, I was having some really good results with robotic surgery at St. Mary's, and a gentleman called me and he said, I'm training for a triathlon and I got to run in 28 days in the triathlon. Can I have a hernia surgery because it's kind of affecting my times? I said, sure. So I fixed his hernia. Within a week, he was back swimming. Within 10 days, he was biking. 14 days, he was running, and he completed a triathlon in 28 days. So
that's amazing, Dr. Short. We're gonna take a commercial break, but I want you to stay here with us because we're going to talk more about robotics. And after the commercial break, we're going to come back with Dr. Short. So stay tuned for more Doc Talk, and we'll be right back.
At Plateau Medical Center, we have the newest technology, which is robotic surgery. Prior to us getting it, you would have to travel out of the area into a larger hospital. By using the robot, less pain, quicker recovery time, quicker return to normal activities, and shorter hospital stays.
This new robotic platform allows us to do what we do and do it even better, and that's only going to benefit our patients.
It's not about the technology, it's not about the robot, it's about patient outcomes.
This is Doc Talk, brought to you by Plateau Medical Center. And now, Dr. Paul Conley.
Welcome back to Doc Talk. I'm Dr. Paul Conley, and again, this is an episode that's a little special here. We're actually on site here at Plateau Medical Center. We're actually in one of the operating rooms. I'm here with Dr. Short. We've been talking about robotics, and we've been talking about the advances that robotics has brought to the forefront. And we're very fortunate to have Dr. Short, who again is our chief of surgery and also is the head of a robotics committee. So we've been talking a bit about, the advantages of robotics, about the benefits, the recovery. And I guess, for those of watching the show, and I myself as an endoscopist, I'm always curious about how does this robot work? When I was in medical school, and the surgeon literally had to put your hands inside of the abdomen to do your work. But tell me a little bit about how does the robot work and how does it differ from the open procedure?
Okay, basically when you do an open procedure, you need to make an incision large enough to, like you said, get both hands in and be able to see. And that incision typically is very large, and it does cause a lot of disturbance to the abdominal wall. In robotic surgery, you make very small micro incisions, probably about 1/4 of an inch in length. You put some tubes in there, and it attaches to the robot, and then instruments are put through those tubes. I do not actually put my hands in there, but there's a high definition camera that goes into the abdomen, and I'm able to set at a console and see inside the abdomen, with pristine clarity of what's going on in the abdomen. I have full control of all the arms that are in the abdomen, and I can actually use the console to change out those arms, and I have an assistant who can change out the instrument for me, just like she would have passed it to me if I was standing at the table. But I have scissors, I've got graspers, I have a needle driver. So when I'm in there, I actually can sew just like my hands are actually in there. The robot gives me that ability. So it causes a very non-traumatic effect on the abdominal wall, but it allows me to see everything in the abdomen and pretty much do anything in the abdomen that I could have done open.
So I know one thing you would try to, for me, in my perception, is the fact that you're actually at a console, correct? And,
yes, sir.
And with that console, you're actually, your fingers is what's controlling the robot. Am I right with that?
Yes.
How do you control that?
Basically, there's like two loops, and I hold them together like this. And so when I work my hands, it actually opens and closes the instruments inside the abdomen. There's buttons to where I can move. Like if I'm out like this, I can push a button and move them here without moving the instruments in the abdomen, but I can open and close, and I have very precise movement in there. I can move my hands. Laparoscopic instruments are very stiff. They're like this. Robotics are almost like my hands. I can turn the instruments like this. I had a knot in a piece of thread one time, and I was able to untie it with the robot. I've seen videos where people can actually cut the peeling off a grape and sew it back on with the robot. It's very, very precise, and you have pinpoint control from the console.
Yeah, I know you were telling me one time, again, just, to kind of like give me a demonstration, the human hand, can only, basically extend so far, and we can only flex so far. But that robot, I mean, it can basically 360 movement, correct?
Right. Yeah, you can turn it all the way over, you can turn it around. There's like no limit to the movement. And the good thing about the robot is, think about like a human pelvis. You're working in a very narrow area. Robot, I can take the camera down in there and see very precisely everything down in there. So it gives me a lot better ability to do surgery in the pelvis than trying to do it with my hands.
Well, I know, one of the things, as far as being able to visualize, I know you're talking about working in the pelvis. I remember, again, when I was a resident and working in the abdomen, I mean, you couldn't see half the time. One, you got someone's hand over what you're supposed to be seeing. You're supposed to be holding retractors, you're pulling retractors, you're stretching tissues. You're trying to see, only so many hands are in a space, and this basically takes all that away, correct?
Correct. And like I said, in the robot, the newer version which we have actually will set up the arms so that they're at the optimum angle for doing surgery in that area. I mean, you can program it to work in the pelvis, upper abdomen, or wherever, and the robot will help set everything up so it's in perfect alignment.
So it's no reason why, that these people recover so fast. When I think about, again, I make rounds with these patients, and that evening, they're ready to go home, but again, I mean, I think about, the days as a medical student, and you're holding the retractors and you're pulling tissues and you're making the incision, and then obviously, you got multiple hands in the abdomen, and all this is done so clean and so precise. And I just think it's, fascinating, the things that we can do right here with this robot right here, Plateau Medical Center. So I guess, we know that, there is no perfect world, and I know that there's like no, in a sense, perfect instrument or even a perfect robot. So is there going to be a situation where maybe a patient, maybe for whatever reason, may not be a candidate for robotics, and if so, what might be that person?
Typically, most people are a candidate for robotic surgery for anything in the abdomen. There's been a few times that I haven't been able to use a robot, and it's usually due to scar tissue or what we call adhesions, because you have to have some area to get 3 or 4 tubes in the abdomen to do the surgery. And if there's just no room to do that, a lot of times you'll still have to do the old-fashioned incision to take down the scar tissue to get in the abdomen and do the surgery. So those are the patients that I typically find that the robot may not be a candidate for that type of surgery, but that also is the type of surgeon, the type of patient that cannot have laparoscopic surgery because of all the scar tissue. So it's just one, but most of the time there's really no limitations on a surgery for a patient.
So is that something that, I know sometimes, I'll have a patient will tell me that they saw you and that, you will tell them that, we're going to start out with robotics, but I think, obviously you tell them that there may be a time that they may have to have it open. Is that correct?
Yeah. I mean, I basically always prepare for anything, but as I say, you prepare for everything, hope for the best. So it's rare that I have to actually open a patient. I mean, to be honest, it's been quite a while since I had to convert from a robotic surgery to an open surgery. But I do tell patients that so that if I have to do that, there's no surprises, that the patient knew about it, they were well informed, and they gave consent that if I have to convert to an open procedure that I can. And I do that for any surgery, whether it's laparoscopic or robotically or whatever. I always say, hey, I'm going to try this, I should be able to do it, but if I have to, I'll do it the old-fashioned way.
It amazes me, I'll have a patient, that I'll perform a colonoscopy on, and again, maybe they're very unfortunate to have colon cancer or again a stricture or something that they may require robotics. And it always amazes me when I see them in follow-up. I always like to look at the wound, and I still have a hard time, like, I want to see a scar, and there's no scar. I mean, it's amazing. So tell me a little bit about, scarring and the wounds and the wound healing and things like that with the robot.
Okay. Typically, depending on the surgery, depends on how many ports or holes I need to put into the abdomen. For hernias, I usually put 3. Colon, sometimes I end up putting 4 or 5. 4 out of the 5 are usually very small, like I said, probably less than a 1/4 inch long. And the other one starts off at a 1/4 inch long, but when we get done, we have to bring what we call the specimen, or the piece of bowel that I removed, out of the abdominal wall. So sometimes we'll have to extend that one to about 3/4 of an inch to be able to get the specimen out. So typically for colon resection, you're probably going to wake up with 3 or 4 1/4 inch incisions and 1 3/4 inch incision. Like I said, a lot less pain than a 12 to 13 inch incision.
Yeah, what I know is these incisions, you can cover them, basically with a nickel. I mean, the incisions are just that small. And it just, again, it's amazing, that robot, the things, that you can do. And it always just amazes me how this patient, that's coming in and having a major abdominal surgery recovers so fast. And it's not only just general surgery, I know robotics, we're able to do robotics for a whole host of, even OBGYN, urology, and they're doing robotics even like with chest surgeries and things like that.
Oh yeah. Yeah, when I was in St. Mary's, they actually were doing lung resections robotically, and they were talking about that there are some cardiothoracic surgeons who now are actually doing bypass surgery with the robot. GYNs can do hysterectomies, and the women that have those do amazingly well when they have a robotic hysterectomy. So, we keep pushing the envelope from the medical standpoint on what it can be used for, and I still feel that the sky's the limit on some of the things that we will be able to do in the future as they advance the technology.
This is really an exciting time, to be in medicine, no doubt about it. We're going to take one last break, and then we're going to kind of finish up here with Dr. Short with robotics. So hang tuned with us, and we'll be back with more Doc Talk.
At Plateau Medical Center, we have the newest technology, which is robotic surgery. Prior to us getting it, you would have to travel out of the area into a larger hospital. By using the robot, less pain, quicker recovery time, quicker return to normal activities, and shorter hospital stays.
This new robotic platform allows us to do what we do and do it even better, and that's only going to benefit our patients.
It's not about the technology, it's not about the robot, it's about patient outcomes.
This is Doc Talk, brought to you by Plateau Medical Center. And now, Dr. Paul Conley.
Welcome back. I'm Dr. Paul Conley, and we're here on site with Dr. Yancy Short here at Plateau Medical Center. So, Dr. Short, we talked about robotics. We talked a lot about recovery. We talked about the advantages. So, maybe just here before we wrap up the show, I'd like for you just to talk a little bit about how important it is that we have something like robotics right here in central West Virginia.
I think the main thing I want to point out is that we can do it minimally invasive. We can do it with less pain, less disturbance to your life, and a quicker return to your loved ones, and a quicker return to your job. A lot of people think bigger's better, but I think the community, the administration at Plateau, the corporate level has made a commitment to providing cutting-edge technology and surgery in Oak Hill, West Virginia. And I think you can get as good a surgery here as you can anywhere in the world and have just as good results, if not better results, than anywhere else in the world. You don't have to travel to the big city. You can stay close to where your families are here and can take care of you.
I really appreciate that, and I do think, one of the things about you being a West Virginian, okay, and myself being a West Virginian, we really appreciate being able to take care of West Virginia folk. And I think, we train in bigger hospitals, and we came back here, and I think that's so you can provide big city medicine with hometown care, and that's what we can get right here.
Yes, sir.
Dr. Short, I really, really appreciate you coming on. I really appreciate you allowing us to be on site right here inside of one of your operating rooms. I appreciate the invitation, and I want to let you know that you're always welcome to come back to Doc Talk. So for those of you watching the show, I appreciate you watching Doc Talk. I'm Dr. Paul Conley, and until next time, have a good night.